Hello, welcome to New Jersey Power and Politics. I'm Alex Zdan. The Delta variant of COVID-19 is on the rise across the country, with hospitalizations in New Jersey increasing by 20% over the last 2 weeks. For more on that, we turn to Dr. Perry Halkitis, Dean of the Rutgers School of Public Health. Welcome back to the show, Perry.
Hey, Alex. Thank you for having me.
So we're hearing about these breakthrough cases of COVID-19 among vaccinated people. How dangerous is the Delta variant to a vaccinated person?
So the Delta variant has become the dominant strain of COVID-19 in the United States over the last month. For people who are vaccinated, the vaccination is the best protection that they can have. Now, what we unfortunately are seeing is that there are breakthrough cases throughout the United States of people who are vaccinated who now get the Delta variant. And in New Jersey, as we know, 49 of those individuals have died. Nonetheless, for the majority of the population, the vaccine does confer protection against all variants that exist out there. This is a work in progress. And there's one really critical point that I want to emphasize to your viewers here is having a vaccine is not a reason to stop distancing and stop wearing masks. All of these are part of a constellation of behaviors that will keep you and your family healthy.
So to that point, do you believe it's time to reinstitute the indoor mask mandate in this state?
You know, Alex, the governor said yet. That was the most critical word in the governor's statement. It may be that we have a mask mandate again. I will tell you personally, because I think scientists should do what they say. They should act and not speak. And I will tell you what I've been doing. When I am outside in an open air space, in a non-crowded space, I don't wear a mask when I'm walking down the street. If I go into the gym or into a store where there are people who I don't know, I wear a mask. And I think it is a really good decision point for people, if you do not want to become infected with this variant, to actually do that. And obviously, for unvaccinated people who are the perpetrators of this pandemic, to be wearing a mask almost everywhere.
Do you feel that vaccinated folks should be wearing a mask mildly inconveniencing themselves for these unvaccinated people who have chosen not to take the vaccine?
Look, I think, Alex, the pandemic perpetuates in this country because of those unvaccinated people. And, I'm not happy that I have to wear a mask at the gym again, because there's, 40–50% of the people in the United States, in our own state, who refuse to get vaccinated. So I think the following, and I've said this all along, which is, I think it has to become mandate that if you want to navigate certain spaces, whether they be concerts or whether they be schools or whether they be gyms, that you are vaccinated. And if you don't want to do it, well, then fine. It is your right. You're right. You don't have to do it. But it is also my right, and it is the right of my health not to be infected by you. So, yeah, I think we need some restrictions here, Alex, to make sure that the rest of us who are doing the right thing, our lives are not upturned by people who are not doing the right thing.
In the meantime, I've noticed this with some interest. There's been kind of a back and forth debate in the media over the past couple of weeks of how to deal with vaccinated people. There's one camp that basically says they're a bunch of idiots, treat them like that. And there's another camp that says, talk to them, listen to them. Where do you come down on that?
So I come down in both sides. Okay. So I will say first and foremost that the United States is a variant factory. The fact that 50% of the people are unvaccinated allows, with every replication of the virus, for variants to develop. And eventually there's going to be a variant that's going to be even more powerful than the Delta variant. The Lambda, for example, which is in Texas right now, is potentially even more harmful. Here's where I land. Half of the people who are not vaccinated in the United States, right? Half of those, so 25%, are probably never going to be vaccinated. There's nothing we can do. But there's that other 25%. And that 25% is not monolithic. People are not vaccinated either because, they don't trust the vaccine. They don't trust their healthcare providers, their doctors. They fear injections and needles. And so what I'm saying is, for those people, we need to talk to them, but one message is not going to work for all of them. How do we get needle phobic people to be able to have a vaccine? How do we get conspiracy folks to take a vaccine? Is a very, very different approach. You have to talk to them. The other 25%, quite frankly, I don't know what to do with. I will say one more point, Alex, which is, let's face it, in the United States, and in a good year, some 59 to 60% of people get vaccinated with the flu. We're not so different from that from COVID-19. So if we could get up to 70% or 75%, we would be in an excellent shape. But that means focusing on that other quarter that remains out there.
The
and
persuadable quarter.
The malleable, the ones we can actually shift. But some we're never going to shift.
Lastly, just very quickly, do you believe that children should be wearing masks in school in the fall?
I do. I think that, I think that right now, masks are the anti-mask movement that we see in our state and in other states on the part of parents. I don't understand it, quite frankly. If I had a child, I would do everything in my power to protect that child's health. I feel, unfortunately, some of those children are being used as political pawns. And so if they cannot be vaccinated, if they are subjected to the virus, and we don't know what variant, Lambda, Omicron, Pi, whatever Greek letter we're going to be to eventually is going to do. There may be a variant that's going to be really harmful. And what we're seeing about people getting sick right now, it's younger people. They're getting extremely sick. There's no reason to believe that this might not affect children in an adverse way if it continues to perpetuate the way it does.
All right, Dr.
Protect your child.
Thank you, Dean of the Rutgers School of Public Health. It is always a pleasure to talk to you. Thanks for doing this.
Thank you, Alex, for having me.